Thank you for taking the time to visit the Paramedic Prescribing Research website. My name is Adam Bedson, and I am completing this research for a PhD at the University of Southampton, funded by the National Institute for Health and Social Care Research. In this brief introductory video, I provide a brief overview of the research topic, paramedic independent prescribing, alongside the planned mixed methods research project. Independent prescribing, sometimes also referred to as non-medical prescribing, is undertaken by appropriately trained healthcare professionals who are able to assess patients, diagnose what is wrong, and then prescribe medication appropriately. Independent prescribing has been undertaken by nurses and pharmacists for many years, and more recently has been introduced for other non-medical healthcare professionals, including paramedics. Paramedic independent prescribing was introduced in 2018, and since this time more than 1,000 paramedics are now prescribing in the range of settings in which they work. These include ambulance services, GP surgeries, emergency departments and urgent care services. It is anticipated that paramedic prescribing will lead to a wide range of benefits for both patients and the NHS. These include providing patients with better and more timely access to medicines, enhancing paramedic practice to enable them to deal with a wider range of conditions and treat more complex cases in the community. However, a number of potential limitations and issues surrounding paramedic prescribing may exist. For example, at the moment, paramedics cannot prescribe what are known as controlled drugs. These include painkillers and sedation, which are often needed. There are also concerns around the training and experience of paramedics who become prescribers, and it appears that currently not all prescribing paramedics have the recommended levels of experience and training. Importantly, very little research has been completed around paramedic prescribing, and so it is not yet clear if and how it is benefiting patients, or if there are limitations and barriers reducing its effectiveness in helping patients. This research study plans to contribute to building the research evidence around paramedic prescribing, so we can better understand how it is currently being used to treat patients, whilst understanding what the current limitations and issues are to maximise its potential for patients and the NHS. In order to do this, the study has a number of important research aims. These include to more clearly understand which medications are prescribed by paramedics working in emergency and urgent care, and to understand the current benefits and limitations of paramedic prescribing. The study will also aim to understand how the training and education of paramedic prescribers influences their prescribing, and if paramedics can access support for their prescribing when needed. In order to provide answers to these questions, we plan to use a mixed methods research design to collect and integrate research data from a range of approaches. This will include interviews of subject experts, case study research at an ambulance service, emergency department and urgent care service to observe the care provided by prescribing paramedics, and then finally using an online questionnaire to seek the views of prescribing paramedics from across the UK. Throughout the entire research project, we will work closely with a team of patient and public contributors who will provide valuable insight and feedback and help us plan and undertake the research. In summary, this research aims to contribute to the research evidence base surrounding paramedic independent prescribing in emergency and urgent care. By continuing to work with key organisations and policymakers, the research findings will ensure we maximise the potential of paramedic prescribing for patients and the NHS. We hope you have some time to look at the different sections of the website which provides more information on the research project. These areas will be updated regularly as our study progresses. If you have any more questions or comments, please feel free to contact us through the contact form below. Thank you.